Hello, friends, and welcome to the channel. You're welcome. Today, we get to talk about Hantavirus, which is currently causing some commotion around the world because there is a ship with people who have been infected with Hantavirus, and some of them have been dying. So, what's there to know about Hantavirus? It's a virus from it's a type of virus from the Hantavirus. So it's in the family Hantavirus, and it is transmitted by a lot of rodents. It's a zoonotic disease, first of all. So a zoonotic disease is a disease that the infectious agent is present in an animal and then can be transmitted to man. So hantavirus can be found in rats, rodents, deer, mice, and some other smaller mammals like that. And from there, it can be transmitted to human beings and can cause quite a number of problems. It's usually present in urine, saliva, urine samples of the individual who is suffering from this particular illness. Now, hantavirus, when it finds its way into a person, it can cause one of two problems. It can cause Hantavirus pulmonary syndrome (HPS), which is an illness where the individual is unable to breathe very well and then has quite a number of signs and symptoms that have difficulty in breathing, and the person needs to be, treated for that. And also there is the hemorrhagic fevers and renal syndrome, hantavirus hemorrhagic fevers and renal syndrome. So also hantavirus belongs to the group of what we call the viral hemorrhagic fevers, which are viruses that cause bleeding in the orifices of those who are infected by such viruses. So hantavirus is such a virus. It could also lead to renal failure. So that's failure of the kidney and the inability of the individual to, function properly with the kidney. Like I said before, the family is the Hantavirus, and it's an enveloped virus, spherical in shape, and it has three segments: the L segment, the M segment, and the S segment. And like I said earlier, you have it in your rats, your mice, your deer, and all of this kind of mammals. And then when it finds its way into the body, it has affinity for particular cells of the body. It has affinity for a lot of white blood cells, the macrophages, the dendritic cells, endothelial cells. It has affinity for them, and it goes to them and attacks them, finds its way into them, and begins to replicate within these cells. So it can lead to quite a number of signs and symptoms in the individuals that suffer from this illness. It can lead to capillary leakage, it can lead to hypertension, pulmonary edema, and like I said earlier, it could lead to kidney damage. So you have an individual suffering from a damaged kidney that's not able to produce urine as optimally as the individual should. Now, the rats or the rodents who have this virus, it is also present in their saliva, their urine, and their feces. And so, if any of these materials from saliva, urine, or feces of the infected rats or rodents are able to find their way into the food, water, or drink of humans, such humans can get infected by hantavirus, and this is a very serious situation. There are situations that expose people to hantavirus. You're cleaning barns in a farm, like those who are on a ship, different farming activities, camping in a rodent infested area. These are some of the activities that expose humans to rodents and can also expose humans to this disease. Sometimes too, on rare occasions, bites by rodents can also expose humans to this disease. What are some of the preventions for hantavirus? You have rodent control, of course, that's number one. Rodent control, proper food storage, sealing of holes in the home, and wearing gloves and masks during cleaning. These are important measures to try to prevent individuals from coming in contact with this hantavirus. Hantavirus globally is more in Asia and Europe than North and South America. These are more, and high risk people for hantavirus include farmers, laboratory workers, campers. These are people that are high risk people. And like I said, let me just the symptoms: fever, headaches, muscle pain, fatigue, and nausea. And usually also you could have hemorrhage as one of the symptoms for this disease. It's diagnosed with ELISA serology, where you check ELISA on its own, then serology where you check IgM, that's immunoglobulin M and immunoglobulin G. And then the samples collected are usually blood samples for the diagnosis of this disease. Now, there is no cure for hantavirus. Usually, what is done is palliative care for the individual who is suffering from this virus to try to mitigate and alleviate some of the sufferings and symptoms. So, supportive management such as oxygen therapy, warm baths, ventilation, fluid and electrolyte therapy, ORS, or being on drips, normal saline, and all of those. These are the things that are done. There are some antiviral medications have also been prescribed. They are not yet certain if they are very, very functional, but they are there. So hantavirus is a virus to be careful about. It causes death, it causes viral hemorrhagic fevers, and sufferers, those who come in contact or are exposed to rodents, must be careful. Thank you for listening. Remember to like and subscribe, and have a wonderful day.